What is rehab or rehabilitation? My name is Fred Bigueras, a board certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab podcast. So I just had a conversation with a patient that has pretty significant knee pain, very young, under 50 years old, and they used to be very physically active, played sports even in college, and they are now facing knee pain with climbing stairs. Luckily, they have actually lost a significant amount of weight in an effort to try and get more physically active and healthy. They met a orthopedic surgeon and they were basically told that within the next 5 years they will need a knee replacement. But more recently, they just had an injection for the knee joints, which has helped dramatically. But the conversation now is, what do we do from here? Now, I don't typically say that kind of stuff to patients because it is very, very unpredictable. However, that's for a different talk or a different time. When I was going over the treatment options for them, basically their response was, I don't have time. I don't have time to do therapy. So that's a really very tough position to put yourself in, where you say that you don't have time, because my question ultimately is, well, what do you have time for? In this particular case, they had time for an injection and they had time to go to the gym. So that's great. But at some point, you do have to learn how to take care of your knees. Now, going to the gym is great in terms of building strength, getting your heart rate up, getting your weight down. Now, I've seen this type of patient before, the very motivated person that is actually going to the gym, making lifestyle changes, losing weight, but they continue to have knee pain. So I understand the urgency and the frustration that comes along with knee pain when you're trying to lose weight. I've had the good fortune of having these patients, and it can be pretty heartbreaking for them because it's like they've always struggled with their weight and they're finally starting to see some gains, and they thought that it was going to be all benefits from here, losing 20, 30, 40, 50 pounds. And they do feel better overall, but now they have this knee pain and it's slowing them down, and they're actually starting to see the weight come back on, and it's frustrating, it's scary, and I definitely empathize with that. I understand where they're coming from. Unfortunately, the way that we exercise puts a lot of emphasis on cardio and strength training, all of which puts pressure on our knees. So anything that doesn't involve breaking a sweat, hitting PRs, I think is not an incentive for the person that has a weight loss goal. So from that standpoint, I understand the I don't have time argument. I have time to sweat. I have time to lose weight, but I do not have time to learn something that may or may not actually change the structure of my knee. And again, that's really a very tough position to put yourself in, because if you are going to make a commitment to staying physically active long term, you have to learn how to use your knees. You have to learn how to use your body. When you only have time to just do an injection or just have a surgery, I don't think that that's a good strategy in the long run, because if you're being hard on your knees, not just from the weight, but just from how you're training, you're probably being hard on other parts of your body, your hips, your back. So if you end up getting a knee replacement and then you start developing hip pain, I almost guarantee I know what the answer is going to be at that point is, I just don't have time. However, there is a tax to be paid when you have underlying arthritis. And in terms of a long-term movement strategy, learning how to take care of your knees is something that most people don't ever take the time to do until they're slowed down by it. Now, whether or not this person is eventually going to need a knee replacement, if I had to guess, probably they will, because unfortunately or unfortunately, they don't have the time. So when you have time for quick things like an injection, even though a knee replacement is not, it seems like it's a quick thing, it's actually really a 3 to 6 month commitment working on your knees. So I'm a big fan of people being proactive in their care, and part of that includes making time to learn how to take care of your knees. So I find that people at a young age with underlying arthritis head towards a knee replacement faster if they don't make time to learn how to take care of their overall health. That to me is probably the biggest predictor of whether or not someone heads towards a knee replacement. It's not based off of the findings on an MRI or an X-ray. And I get that question all the time, is like, do my knees look like they're older than they should be? Or do my knees look like I need a knee replacement within the next 5 years? You cannot reliably look at imaging and say this person's going to have this pain and this person's going to respond to an injection. This person is going to need a knee replacement. You simply can't do that. However, I find that the behavior and the approach of the patient is very predictable. You know, if someone is very proactive in their care and open to trying new things and they make time to take care of themselves, those folks tend to not need not necessarily a joint replacement, but they tend to not need much medical care because they've already taken it upon themselves to put effort towards taking care of their bodies and taking the pressure off the joints. But when people don't have time, and I'm not saying that they actually don't have time. Some people are super, super busy. If you don't have time and you need quick fixes, or you rely on other people for care, then you rely on their care, which means that you end up with an injection, you end up with a joint replacement. So just something to think about in terms of how you take care of your body, take care of your knees, and how you approach your movement goals and even weight loss goals in the long term. Hopefully, this was helpful. Take care. Thank you for listening to the Talking Rehab podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement filled day. Take care.